If you've ever looked into joint surgery, you know there are a ton of assumptions floating around. Well, today we're going to cut right through all that noise and uncover 5 surprising truths that might just change how you think about the whole thing. Let's dive in.
So right off the bat, I want you to think about this question. What do you think is the one thing that matters most for a successful joint replacement? Is it how old the patient is? The fancy new technology? Maybe the brand of the implant? Just keep that question in the back of your mind because I'm betting the answer isn't what you expect. We'll get to it. First up, let's talk about hips. And we're not just talking about any hip replacement, we're zeroing in on a specific type that carries a very particular and kind of hidden risk.
So first, what in the world is a cemented hip prosthesis? It's pretty much what it sounds like. It's an artificial joint that's literally glued into place with a special kind of bone cement. It's a really common technique, especially for patients with weaker bones, because it makes the joint stable right away.
Now look, any big surgery has risks, right? Things like infection or the joint dislocating. But when we're talking specifically about these cemented hip implants, one of these potential problems really stands out from the rest. And here it is, the big one, a bone fracture, right where the cement meets the bone. This can happen if that bond isn't perfect, especially if the bone itself is a little weaker. So get this, it's not the implant breaking, it's the actual bone around it.
Okay, let's move on to our second surprising truth. This one is going to answer that big question I asked you at the very beginning. We're talking about knees and the real secret to a successful replacement.
So, what do most of us think is the deciding factor? Does being younger and healthier guarantee a better result? Is it all about getting the newest, most expensive implant on the market? Or maybe it's about how active you were before you went under the knife? Well, all those things matter, for sure. But none of them, not one, is the most important thing.
The answer is the surgeon. That's it. The single most critical factor for a successful total knee replacement is the person holding the instruments. So, why? Why does it all come down to the surgeon? Well, a great outcome really depends on their skill in 2 key areas: getting that implant aligned perfectly and balancing all the soft tissues, the ligaments, around it. That balancing act is what ensures the knee feels stable and moves smoothly. It's the classic example of where human skill and technique completely trump technology.
All right, let's switch gears a bit. We've been talking about surgery, but now let's talk about the condition that often leads to it, arthritis. Our third truth is a really simple trick to tell the 2 most common types apart, because believe me, they are very different diseases.
The real key here is the pattern. You see, rheumatoid arthritis, or RA, is symmetrical. Think of it like a mirror image. If your right wrist is acting up, it's a pretty safe bet your left one is too. But osteoarthritis, or OA, is usually asymmetrical. It's random. You might have it in just one knee, and the other one is totally fine. That one clue, symmetry, is the biggest giveaway.
Okay, on to truth number 4. And this time we're heading to the shoulder. Now, shoulder replacements can be life-changing, but they do have one complication that happens way more often than any other. You know, patients often worry about things like infection or the implant coming loose over time. But if you look at the numbers, the biggest hurdle, by far, is actually dislocation. It just happens a lot more frequently than those other serious issues.
So why does the shoulder dislocate so often? Well, it usually comes down to either an imbalance in the surrounding soft tissues, which again can go back to the surgical technique, or some kind of injury after the operation, like a bad fall. The shoulder joint just has this incredible range of motion, which is great, but that also makes it naturally less stable than, say, your hip.
And for our final surprising truth, let's circle back to osteoarthritis. There's this massive myth out there that it's just a wear and tear disease that you get from getting old. But you know what? That's not the whole story at all. This is where we run into a term called secondary osteoarthritis. So unlike the primary kind that's often linked to aging, this type has a specific, identifiable cause. Something happened to that joint that kicked off the whole arthritis process.
So what's the big trigger for this? You might think it's your genes, or maybe being overweight, and yeah, those can play a role. But the number one cause of secondary osteoarthritis is a previous injury to the joint.
And this could be anything. It could be a fracture that went into the joint, a major ligament tear like an ACL injury in your knee, or a torn meniscus. I want you to think back to that nasty fall you took, or maybe that old high school sports injury. That kind of trauma can mess up the mechanics of the joint and set the stage for arthritis years or even decades down the road. Wow, okay. We've covered a ton of ground here, right? From hips and knees to shoulders and the real causes of arthritis. So let's just do a quick, rapid-fire recap of the 5 surprising truths we've just learned.
Okay, let's nail these down. 1. For hips, that hidden risk with cemented implants is a bone fracture. 2. For knees, it's all about the surgeon's skill, not the implant. 3. To tell arthritis types apart, remember that symmetry means RA. 4. For shoulders, dislocation is the biggest post-op hurdle. And 5. The #1 cause of secondary OA is an old injury, not just aging.
Look, this isn't just interesting trivia, right? This is information that can really empower you. It changes the conversation you might have with a doctor from, so what implant am I getting, to how do you make sure the alignment and soft tissue balance are perfect? So I'll leave you with this to chew on. Now that you know all this, what's the one question you'd ask your doctor?